Dr. Stephen Brown is a board-certified radiation oncologist with Austin CyberKnife, and he's here to talk to us a little bit more this morning about metastatic cancer. Good morning, Dr. Brown.
Good morning. Glad to be here.
Thank you so much for coming. Let's talk about metastatic cancer because that's a term I've heard before, but if you asked me for a definition, I wouldn't know it.
Metastatic cancer actually is a primary site of cancer in your body that is spread. It can either spread to other organs or other parts of the body. So it is a cancer that is no longer in the primary site where it started. A good example would be, say, kidney cancer that has spread to the lung. It's metastasized to the lung.
I see.
So the cancer in the lung is not lung cancer, it's metastatic kidney cancer or renal cancer.
Okay, all right. So when you talk about it, then you would still say kidney cancer, but metastatic, you've also got lung cancer that has spread to the lung.
That is
you have
correct.
to be careful with your terminology here. I'm learning this morning. Okay. Let's talk about how cancer cells spread. You know, how could it possibly go from the kidney to the lung?
It can spread either via the lymph nodes, which could then go to local lymph nodes around the kidney, or it can go into the bloodstream, and then it can go to any part of the body.
Mm-hmm. And I know lymph nodes are something that people bring up a lot, especially when we talk about things like breast cancer, because the lymph is a place where it can spread. But you're saying it can apply to all sorts.
Yes, both lymph nodes are predominant first means of spread, secondary is through the bloodstream.
Okay, I see. Now let's talk a little bit about CyberKnife. We feature you guys a lot on the show, but I think CyberKnife is so medically ingenious. Let's talk about what it is and what it does.
CyberKnife is a very sophisticated radiation therapy system. You'll hear stereotactic radiosurgery is what's typically the advanced form of radiation that we give with CyberKnife. It delivers very precise, precisionally focused beams of radiation, and those beams are controlled by a device on the machine that controls the size of the beam that allows us to treat multiple sites, not only intracranial but extracranial in the entire body.
Okay, all right, and so it sounds like it would be good for something like metastatic cancer. What are the benefits of using CyberKnife, especially when we talk about metastatic cancer?
The benefits of CyberKnife is that it's a outpatient, non-invasive approach, non-invasive meaning no incision, so there's no anesthesia, no hospital stay. It's precisionally delivered, so there's minimal side effects related to the treatment, so it's tolerated well.
Yeah, and when we talk about how CyberKnife has kind of changed the game, you know, just give me a snapshot of how things have improved since using things like traditional chemotherapy, something like that.
Well, one of the real benefits with CyberKnife is the few number of treatments. When you're looking at anywhere from as many as 5 or less outpatient treatments versus 8 weeks or more, it really cuts down the treatment time. Because there are minimal side effects, the patient's able to maintain their work and actually be able to get off the treatment and go about their daily activities. So because of the technology, the improvement, the reduced time, people are able to tolerate treatment and be effectively treated.
That is so cool that things have changed in such a positive way. Dr. Brown, great information this morning. Thank you so much.
You bet. Thank you so much.
Dr. Brown encourages you to go to austincyberknife.com to find out more information about metastatic disease. Austin CyberKnife is located on I-35 near the Del Seaton Medical Center at the University of Texas. Call them 512-324-8060 for more information.